Good morning.
Good morning.
My name is Andrea Craig, and I'm going to be your RN today. I'm here to do your head-to-toe assessment. Now, may I have your name and date of birth, please?
Adrian Cambridge, 12/28/1978.
Okay, thank you.
You're welcome.
And and I'm looking at your physical appearance. I'm showing that you're here, you're alert, you have full range of motion with your mobility. Your behavior is alert, and your body structure, it is symmetrical. Now, are you in any pain this morning?
No, I'm not.
Okay, great. Now, let me ask you this. Do you know what time it is?
I guess it's around 12 noon.
Okay, and your age?
I'm 36.
Okay.
Well, actually, I'm 35. I'll be 36 on the 28th of December.
Happy early birthday.
Thank
and, do you know your location?
Yes, Troy School of Nursing.
Okay. And do you know why you're here?
Head-to-toe assessment.
Okay. All right. Now, what I'm going to do is what we refer to as heat. Now, I'm going to palpate your temporal pulses, which are even. And I'm going to do your carotid pulses one at a time, because I don't want you passing out on me. Very strong. All right. Okay. Now I'm going to test cranial nerve 2, what we refer to as Perla. What I want you to do is to focus on something behind me. Follow the pin light. Okay. All right, I'm showing that your eyes do converge on the axis. Now, also, well, let's do this. Focus on something behind me as well. Okay. Your pupils are dilating on both sides. That's great. All right, now next we're going to test cranial nerves 3, 4, and 6, which is the 6 cardinal fields of gaze. I want you to follow the pin light for me. Okay, now follow my finger. Excellent. All right, now we're going to test cranial nerve 8, which is the whispered voice test.
ABC. DEL.
All right, now I want you to clench your teeth for me while I palpate. Clench your teeth. Great. All right, now we're going to test cranial nerve 7. I want you to wrinkle your forehead for me. Okay. I want you to smile and puff out your cheeks. Great. Now we're going to do cranial nerve 9, which is the gag reflex. Okay. Now cranial nerve 10. I want you to say ah.
Ah.
Let me look at you.
Ah.
Okay. No deviation there. And with cranial nerve 12, I want you to stick your tongue out and wiggle it from side to side. Excellent. And I want you to push against my hand again. Okay, shrug your shoulders. Great. All right, now I'm going to check to make sure your trachea is midline. Hold your head up just slightly for me. Okay. I'm going to palpate for that thyroid gland. Make sure it's okay. All right. Now we're going to do the chest. I'm showing that your skin, let's see, it is even. Your moisture, I'm not showing any signs of dehydration. Your skin is warm to the touch. And I'm showing that your skin is intact. Turgor is okay. All right. Now I'm going to listen for your breath sounds. I want you to take a deep breath for me. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, I'm going to go behind you. All right. Deep breath. Deep breath. Deep breath. Deep breath. Deep. Deep breath. Again. And one more time. Great job. Now, our 3 normal breath sounds are going to be the bronchial, which is located in the trachea and the larynx. Now, the pitch is high and the amplitude is loud. Then we also have the bronchovesicular breath sound, which can be located in the major bronchi, and the pitch is moderate and the amplitude is medium. And then we also have the vesicular breath sound, which is located in the peripheral lung fields, and the amplitude is soft and the pitch is low. Excuse me. So now we're going to listen for those heart sounds. I'm going to use the bell as well as the diaphragm. First, I'm going to listen to the aortic heart sound, which is located in the second intercostal space. And just breathe normally for me. Second is going to be the pulmonic breath sound, heart sound, and also in the second intercostal space. Then we have Erb's point in the third intercostal space. Then we have the tricuspid heart sound, fourth intercostal space. And then the mitral, which is in the fifth intercostal space. All right, and here is where I would take the apical pulse for a minute. All right, let's just say a minute's been up. Now, what I'm going to do after that is to look at your upper extremities. I want you to hold your arms up for me. Hold them out for me, I'm sorry. Okay, well, do this for me. Thank you. All right, I'm showing no signs of edema or tremors. I'm showing that your skin is even, intact, no signs of your skin is firm and intact, and it's warm to the touch. And do that for me. There you go. Now I'm going to palpate your brachial pulses. Okay. Next, I'm going to palpate for your radial and ulnar. Okay. All right. Let me test your capillary refill. And it should refill within less than 2 seconds. Great job. All right, now I'm going to have you to lay on your back for me. I'm going to take listen to those. Also take those vowel sounds in a clockwise position, starting in the right lower quadrant around the umbilicus. This will help. Okay. Now I would palpate for abdominal distension, non-present, as well as bladder distension. You're fine. All right. And then here is where I would check for the femoral pulse, which is located just below the inguinal ligament, and it is a 2+, and it's halfway between the pubis and the anterior superior iliac spines. And I will also palpate, if you raise your leg up for me, palpate for the popliteal pulse. Okay. Also, the dorsalis pedis. And I would also check the posterior tibial pulse. Okay. Next, I would have my patient to push. Great. All right, check for capillary refill. Okay, great. All right, well, this concludes my head to toe assessment. Thank you.